So to manage these and to deal with these types of symptoms with the light sensitivity, the sound sensitivity, the queasiness, the nausea, there are a number of different approaches to that. Yet generally speaking, one of the best things to do after you've had a concussion or a suspected concussion is to really pull back temporarily from normal daily activities. Now, we don't necessarily recommend that you just go sit in a dark room and do absolutely nothing like we used to recommend 15 to 20 years ago. But what we do recommend is that you really try to limit time on screens, be it tablets, iPhones, plasma screen TVs. There's really something about the electronic screen that can be really stimulating and irritating, especially to that light sensitivity after a concussion. With regard to sound sensitivity, really just common sense plays into factor there. You'll want to avoid scenarios and environments that are excessively loud because those are going to be problematic for a few days afterward. And then finally the nausea, that queasiness in the stomach. There are certain medicines for that. Usually we don't have to go that route. The good news with all of these symptoms are in the far majority of the people, they tend to be short-lived. And if you can just approach this with the mindset of, I need to just pull back a little bit from normal activities for 2 to 3 days after the injury, and then you can quickly thereafter soon start to reintroduce those things on a normal